This video will be explaining and justifying the need for a calming corner in classrooms, specifically classrooms with students diagnosed with autism spectrum disorder (ASD) and attention deficit hyperactivity disorder (ADHD. The video will explain the resources included in a calming corner, specifically the sensory bottles and how they enrich the classroom environment for these students as well as students without diagnosed disorders. The calming corner is a corner in the room where students can go to have some time out. Here, they can calm down, collect themselves, and become focused enough for work. It is known that children with ASD often have common social and behavior deficits. This usually means that these students do not always react to a situation according to the social norm. Students with ASD could possibly become frustrated or even angry when pushed beyond their safety limit. Whereas another student in this situation may just put their hand up and ask for help, students with ASD will either stay quiet and refrain from completing their work or become explosive and angry. To help discourage this behavior, Ms. Doran has placed a calming corner including sensory bottles with calming music and headphones in the back corner of her classroom. So when a student feels frustrated or angry, they can come and sit on one of the pillows in this area, shake one of the bottles, and focus on the bottle until all of the glitter inside has settled to the bottom. The settling times of these bottles are timed between 3 to 5 minutes, and some of the bottles have some little shapes or small objects inside for the students to find and count. When the bottle has settled, this means that the student is usually feels calm enough to go back to work. Although the sensory bottles are best used with students who have ASD, this resource is also a great tool for students who are diagnosed with ADHD, as these bottles encourage students to meditate. For students who have ADHD, this typically means that the student may struggle with maintaining focus for a long period of time. Learning how to quietly meditate in the calming corner could help. Starting with the quickest sensory bottle and combining with the calming music will help the student to stretch their attention span. This method also helps calm the students who also deal with anxiety along with their ADHD, which accounts for roughly 1/4 of the people diagnosed today. With these students' lack of attention span, the first few attempts of meditating with the sensory bottles may have to be repeated a few times to ensure they are doing it correctly. This corner can also be used when transitioning from break time back to the classroom to help calm down the students, which provides them with that extra element of inclusiveness in the classroom. Again, although this resource is primarily for students in the classroom with ASD, any student who is feeling frustrated or angry is encouraged to use the calming corner. This resource is a whole classroom resource, as all students at some point may feel frustrated, angry, or even hyperactive, and giving all the students access to this area allows every student to feel included. This will also help the students who really need it feel less singled out just for using it. And as long as every student is aware and respectful of the rules assigned to this area, then the teacher should see nothing wrong with making it a completely inclusive resource, thus focusing on the element of inclusive education within her classroom. The reason this resource was chosen is because of its versatility. The sensory bottle was first created via jars to help children self-regulate their emotions. This concept then developed into its bottle form and is used at home during time out to help both track the time and help the children calm down easier. It has since then been adapted into occupational therapy during exercises to help ASD children learn how to self-regulate, especially the children who do not like physical contact. For these patients, instead of trying the physical methods, they will be given one of these bottles to sit with instead. It is due to this versatility that makes this resource valuable in a calming corner, and as it is small, it is easy to be held by all of the students. The best outcome for this area would be for the students with ASD to recognize when they need time alone and quietly go to the area to calm down. Another great outcome could be a greater focus for the students with ADHD in regards to their work and for longer lengths of time, which could lead to a better grades overall. Of course, if a student keeps going to play with the bottles, then they will be issued a daily limit of passes to ensure that they are going in for a valid reason and not just to avoid doing their work.